Hi, I'm Tim Wiedrich, Section Chief for the Health Resources and Response Section for the North Dakota Department of Health, and this is our weekly statewide hospital briefing. This is a jointly held meeting with the with the Hospital Association, and so let's check in real quick and see if we have Tim Blazel with us this afternoon. Tim, are you there? I'm not seeing him today, and so we'll check back with him next time we're together. We do have several pieces of information that we want to bring you, and so let's go ahead and lead off to see if Grace is with us for the hospital intelligence update. Grace?
Hi, Tim. Can you hear me?
Can hear you just fine.
Perfect. I will just share my screen. Okay, well, good afternoon, everyone, and we are back on our Intel update. So continuing where we left off the discussion last week, I think last week I did report we had observed this increase in our RT value. It had gone up to about 1.09, and this week I'm happy to report that we've observed a decline. So we're currently sitting at about 1.02. As I've mentioned in the past, you don't want your RT to be above 1 because that usually indicates that the disease is being transmitted to one person. But at least, I'm hoping this, continues to be the trend that we see that decline, and that what we observed last week was a bit of an anomaly. But this is something that we'll just continue to keep track of. And overall, and as a whole, we do see, fewer cases, and so that's still good news compared to what we've seen in the past. In terms of the counties that really do stand out, Adams County, which has in the past not really been as high in terms of the reproduction number, it seems to be the county that is driving a bit of the, that high or at least the above 1 threshold, because they are currently sitting at about 1.5 for their RT value. But the good news, and on the flip side of this, is that when I think last time I checked, they only had about 19 active cases in Adams County. And so really what this is indicating is, how many people are getting the disease from one person. And so for Adams County, there is that threat. But as a whole, it does translate into fewer numbers with that being one of our smaller counties. And this is just a map that shows from week to week the change. And as I mentioned, Adams County does seem to be the one county that was a bit of an outlier this week with about 143% increase in their RT value. And from this map, I think, I don't know if you can see this clearly, but one of the other things that we noticed this week is our larger counties such as Cass and Burleigh, which in the previous week had a bit of an increase in the RT value. We are seeing some minor decreases, which is good news because these are our largest counties for individuals who've been positive over time. And also they tend to be sort of like the really major drivers of the high case numbers that we've seen in the past. We have observed some increase in the uptake of the testing this week compared to the previous week. And so when you look at and this could probably just be coinciding with the holidays, that week of New Year's. But overall, we've seen about a 35% increase in the number of people who took tests this week. And we're also seeing more of the uptake of the antigen testing. And that's what you see in the gray bars compared to the orange bars, which are the PCR tests. And then I have shared this graph in the past. And this is, again, what you really want to see is sort of like this alignment of the PCR positivity and the antigen positivity because of some of the concern around like antigen testing, which is for a while there was a concern that, the antigen test could have a high false negative rate. And so when you see this sort of like alignment of the positivity rates of the PCR, which is considered to be the gold standard, and the antigen test, that is promising. And we do have a few outliers, such as I believe this was early January, like January 1st and late December, where we had 2 instances, or at least on a single day, where the positivity was slightly different. Well, actually not slightly, quite significant, because you observe 13% compared to 5% and 21% compared to 4%. And that is concerning because then you basically wonder if the gold standard has a much higher positivity rate compared to a test that's known to have high false negativity, what's going on there. And in doing some investigation internally, what we found was that a lot of these PCR tests were coming from healthcare providers, which is, these are facilities and individuals who are likely to test positive anyway, because part of the reason why you go to your healthcare providers to get a test, as opposed to going to a testing event, is more likely than not you're symptomatic and you're ill, and so it's more of a confirmatory test. And so for those due dates, while there were concerns, I believe we can explain some of what was happening in the testing positivity difference. And then overall, I think I've shared this in the past and it hasn't changed much. We do continue to see a decline in the, our neighbors and what's happening in the region. So all 4 states seem to be on the decline in terms of the number of individuals who are hospitalized per 100,000 people. And I think I've also shared this in the past, but I definitely prefer hospitalizations as a measure of comparison, because this is a little bit, actually, it's not really driven by testing because, or at least not 100% driven by testing, because really the number of people who are severely ill, it doesn't matter whether you're tested or not. If you're hospitalized with COVID, it's more likely to be more standard across the region. And the one thing I would like to highlight here, one of the differences that we are seeing between the Dakotas, for a while there, we had these two intertwined where, North Dakota and South Dakota would sort of like switch places back and forth in terms of who was having the worst outcomes. And I think this just kind of like builds on the case for the value in having some of the mitigation factors we have in place, because what you're seeing in North Dakota, which is this yellow line, is a more just a faster drop in the rate of the number of people who are hospitalized compared to the South Dakota. And while, Montana and Minnesota have had mitigation factors in place, overall, they've really remained relatively low compared to North Dakota in terms of people, or North Dakota and South Dakota in terms of the people hospitalized. And then the other thing that's happening is, I believe some of you may have seen this already, but in sort of like the effort to really keep people out of the hospital who are, who may get ill from COVID, this is the monoclonal antibody clinical guidelines for providers that Dr. Connell at the health department put together with her team at the Physicians Advisory Group. And as you can see, this is basically to really target the individuals who have mild to moderate symptoms, and really establishing who is a good candidate for this outpatient therapy, and so we can keep them out of the hospital. So this is, I believe, up and running. And if you do have questions about this, I would certainly reach out to Dr. Connell. And I believe some information is also available on our website in terms of being able to identify these outpatient therapy centers. And then looking ahead, this has not changed much. We do calibrate our model at least once a week. And overall, what we do see is just this downward trajectory moving forward. And as I've shared in the past with this group, some of this, if not most of it, is really driven by the number of people who may have previously been infected with COVID. And so over time, we do anticipate that, this will continue to be on the decline. But again, this is very much shaped by current behavior. And so if we do decide to, let loose and, start following our mitigation, then this could change at any point. But really overall, what we expect is this downward trajectory. And for hospitalizations, again, following a similar trend. So what you see in the orange is our projections, and then what you see in the blue are the actual cases. And for the last week or so, we have been, the model seems to be actually overestimating the number of cases that we expect to be hospitalized. And then these are just the projected deaths. And again, these being lagging indicators, we do see that, we're on the decline as well in terms of the deaths being projected. And it does look like the model, again, has been overestimating the fatalities that we do expect in the model. Tim, I believe that's really all I have for today. So thank you for having me. And please, I'll stick around for any questions. Thanks.
Thank you, Grace. Well, we know that the hospitals have been submitting a significant amount of data that goes to the federal level and is also consumed at the state level, and also has implications for building a common operating picture as well throughout all the rest of the levels of government. One of the individuals that has been helping us with the data submissions is Cody Pinks, and I know that we've added some additional data elements recently. Cody, do you have anything to report?
Hi, Tim. Hi, everybody. Yes, I do actually have an update. HHS sent out a revised guidance reporting document for the hospitals. I sent, I think, a mass email to everybody yesterday. So if you did not receive one, let me know. But HHS is adding 7 questions related to the vaccination of healthcare workers with the COVID vaccine. So there are 7 questions that will need to be incorporated into HC standard. We're hoping to have those added in by January 20th because I know that state staff are definitely interested in this information. It is not required by HHS to be filled out yet. I think that time will come, but I know our state leadership definitely wants that information and needs it. So I will let you guys know when that officially gets added in, but it's only once a week reporting on Wednesdays. And if you have any questions about the questions, please get a hold of me.
Thank you, Cody. Dr. Joan Connell is with us today, and we have, and hopefully she'll be able to join us in future meetings as well. I know that Grace had mentioned monoclonal antibodies, and we've had a lot of attention begin to be paid to out-of-hospital therapies. And I'm wondering, Joan, if you would be willing to, Dr. Connell, if you would be willing to talk about 2 things. One is describe a little bit about the physician advisory group that Grace had mentioned, and then also some of the work that's been happening around creating higher awareness about the out-of-hospital therapies. Dr. Connell?
Thanks, Tim. So the Physician Advisory Group is a group of physicians through the North Dakota Medical Association. And we meet Thursdays and talk about issues relevant to the pandemic and to the overall health of North Dakotans. We've been in existence since March, starting in the Department of Health, and then moving over to North Dakota Medical Association in August of 2020. So that's been very useful in getting a pulse of how physicians with a lot of experience from all around the state, what they're experiencing, what's working for them, and also any challenges they might be facing. And then we can work on making those concerns and those pluses known to state leadership, and maybe with partnerships improve whatever isn't working right or share best practices. One of the examples of this is monoclonal antibody therapy. But we've noticed is in spite of receiving several hundred vials of monoclonal antibody therapy, we've only utilized a fraction of that in our state. So really, that is a shame. And every time at this point you see a death, and it's occurring in a person who had a risk factor, we need to take some responsibility for that if they did not have the benefit of receiving monoclonal antibody therapy. And so that really drives me to want to make sure that we are making this therapy available to citizens who have risk factors from around the state. So things we have done to affect change are making sure that all the critical access hospitals, as well as the big 6 hospitals, have some vials available so that patients don't have very far to travel to receive the therapy. And I want to let you guys know, and please share it with your pharmacy and charge nurses and anybody else who might be receiving calls about this. It is okay to reallocate the monoclonal antibody that has been distributed to you. If somebody's calling and you and needs some, feel free to share it with them. And if you don't have any to share, make sure you have them call the doc, and we can help you find doses for your patients. The other thing we did is VP3 developed that beautiful algorithm that Grace showed, and we've been trying to distribute that. It's available at the doc. It's available to long-term care facilities through the Long-Term Care Association. It's available to FQHCs. It's on our North Dakota Department of Health coronavirus website in the provider section. And we also have it available for the hotline operators so they can help access therapy locations. Parallel with that, we have been developing this spreadsheet that contains information about all of the locations that are providing monoclonal antibody therapy. And that spreadsheet contains information about if a provider calls and asks, how do I get hooked into the system? Where's the closest therapy for my patient? As well as if a patient calls and asks, I think I might be a candidate for therapy. What do I do? So we can connect them with the nearest infusion center. And so if you are using monoclonal or providing monoclonal antibody therapy for your patients, and you're not sure if you're on the list, or you have information that has changed, don't hesitate to call me or contact me. My email is jconnell@nd.gov, and that's 2 N's and 2 L's. And then another thing we've been doing to try and get the word out is VP3 has been contacting facilities that have positive long-term or positive patients residing in the long-term care facility, because almost by definition, those patients are all high risk because age is a risk factor. So if you're 65 or older, you are a candidate. And I think that will be very successful. And we're exploring other risk groups, including children in certain other disease states where we think we might be able to call out those positives possibly. And then finally, we're working on an educational campaign. Dr. Rainham from West River Health Services in Hettinger is really the champion from the governor's office on this project, and he's a great representative and one of our physician advisory group members and the vice president of the North Dakota Medical Association. So he has provided some information about this. He wrote an op-ed about it. I think he'll be speaking at a press conference later this week on this topic. And hopefully we'll be able to expand our educational campaign to include social media and other more public opportunities for sharing the word. I'm happy to answer any questions if you have any. I know that was a lot of information, but there's a lot going on because we need to reach all of the patients who are candidates.
Thanks, Dr. Connell, and we'll have questions at the end, which will be coming in the not-too-distant future at the end of this program. Let's check in now regarding the vaccine update. George Gerhardt. George, we're not hearing you if you're talking.
Hold on, I'm here. You hear me now?
Now we have you.
There we go. So how's everybody doing on this beautiful January, not so typical winter day in North Dakota? The vaccine update for this week is, as you all may have heard, there are some statements that were made about releasing the second round of vaccine along with the first round right away and not holding any back. That has not occurred yet, and we have not heard if it is going to occur or when will occur. We will keep everybody posted if it does. As of now, we still are ordering second rounds of vaccine as usual. So vaccines basically, people would receive the same order 3 weeks after the first order. So that's how it's occurring right now. This week we had quite a busy week here at the warehouse. On Monday we received our vaccine. On Tuesday we pushed it out and delivered it. We had a total of 13 routes with 585 vials of Pfizer going to 25 stops. And that made 2,925 doses. And then we had 31 stops for the Moderna vaccine, which came out, which was 70 vials altogether, which were 700 doses. Today we received another 3,400 doses of Moderna, which is the second round for the week that was right before Christmas. That'll be going out Friday and then Monday and Tuesday. And that'll be going to 104 different sites, consisting of about 9 routes. Altogether, that's, like I said, 3,400 doses. On Monday, which is Martin Luther King Day, we will not be receiving vaccine on that day as usual. It will be here on Tuesday, and we'll adjust our delivery schedules as needed to accomplish and get that stuff out. Again, we'll try to get it out as fast as possible. We do try to get it out within 24 hours of receiving it, but due to weather and other circumstances, it may take a little bit longer. We do make phone calls prior to our shipping it. So the day before, we confirm that we will be arriving on a certain day. It's hard to give a time because routes and timing may change again based on road conditions, weather, and other circumstances. And then our drivers will call at approximately 30 minutes prior to arriving there. If it's multiple deliveries in a town, it may be a little bit shorter notice, but we always try to do at least a half an hour before arrival to confirm that somebody there is to pick up. That's all I have for this week. I'll be standing by for questions.
Thanks, George. Let's turn now to a testing update. There's still a considerable amount of testing that's going on, and let's check in to see if we have anyone with a Health Research and Response section to give us a quick update. It doesn't appear that we have anyone on with us today, so let's move on to the PPE supplies, and we'll check in with Angie Strand.
Hi, thanks, Ken. So this is Angie here. I'll just stand by until my slides are ready to go. Great. Thanks, Clint, for reworking my slides for me. I appreciate your hard work. So we'll go ahead and start with the N95. So we're overall the cash is looking really good. Slowly but surely, we're getting the items that we put orders out for coming into the cash. So as of right now, it's looking pretty good. And 95s are at 1,058,400, with 445,960 of those being the most fit tested 3M 1860 model. There were 400 issued within this last week. We have received 50 of the 100 fit testing kits that we ordered to assist with any fit testing needs that might arise for the fit testing of the 3M 1870 Plus that we're currently getting into the medical cache. Those are available for checkout, and if you need assistance with that, you can feel free to contact me, and I'd be happy to assist you with that checkout. We'll move on to the surgical masks. So we're at 2.8 million, and there were 2,600 issued within this last week. For shoe coverings, they're sitting at the same number as last week. There aren't very many requests for shoe coverings at this time, but they are available. And for gowns, I'll just speak on those. We're at 1.1 million, so 1,184,970. There were 500 issued last week. We had 3,900 cases added to the inventory tracking system on the 11th, and those came in from an order that we placed. For gloves, we're at 1.9 million. There were 61,500 issued of various sizes within this last week. Glove requests remain to be constant and probably the most popular thing that's being requested from the state medical cache at this time. Overall, within the last 2-week operational period, we had 117,000 issued. For face shields, we're at 64,852 with 780 of those issued last week. And goggles are at 17,452, and there were not any requests for those within this last week. But we are looking to purchase more of the goggles going forward so we can bring our numbers up to pre-COVID cache numbers for those. Additionally, I've received questions about facilities and services who have requested PPE from the cache on how to replenish back into the cache. Customarily, we encourage donating back to the cache the amount, the brand, and model of what was requested and received. However, if we are at or above pre-COVID numbers at the end of this response, donating back will not be necessary because it was replenished by us utilizing CARES Act funding. So that being said, we cannot make a full determination until a later date. So this pretty much concludes my portion of the briefing. Feel free to ask me any questions at the end of the meeting. Thank you.
All right. Thanks, Angie. Well, we've heard the VP3 team mentioned several times, and so let's check in with them. Let's see if we have Roseanne, Jan, or Seth with us.
So good afternoon, Tim. This is Jan. And as mentioned, we have been busy working on getting that information out on the monoclonal antibiotics. So every day as we receive information about where our positive residents are, we are making phone calls personally to those long-term care facilities to assist them in getting information and getting their residents hooked up, if need be, with the appropriate resources so that they may receive that monoclonal antibody infusion. So that's been keeping us pretty busy. We continue to meet with the big 6 hospitals as far as capacity goes. We're now on weekly meetings with them, but we are getting their data daily. So just to keep our pulse on bed capacity. And as Grace's number indicated, as we watch the counts go down, we see capacity opening up in all of our facilities. And that concludes my report.
Thanks, Jan. Well, that also concludes the information we intended to bring you today. All in all, in summary, the numbers are moving the right direction, and we have some nice weather out. And so, while it is, certainly we are in a far better position we are today than we were in the not too distant past. It's also not a time for us to become complacent because we're seeing what some of the rest of the nation is going through at this time. And so our thoughts are with them, and we're continuing as a collective team all of our vigilance in keeping this process moving forward. Let's go ahead and open it now and see if we have any questions or comments. We have about 50 sites on, but I'm going to risk it and not go around the state like I normally do. Let's just go ahead, and if you have a question or a comment, just go ahead and open up your microphone and go ahead and state your question or your comment. All right, well, I'm not hearing any, so it wasn't much of a risk. We didn't have much of a collision there. We'll be back together again next week, Wednesday. We're doing this now once a week on Wednesdays at 2 o'clock. Remember that if you have an interest in a past meeting or someone else wants to see the meeting that we just held, they are archived on our website at www.ndhealth.gov/ET. Thanks for being here and participating. I look forward to talking to you again next week. Take care.